Director of Strategy Consulting for Updox and serves as the voice of the clinician for Updox Solutions and Services. She is the past president of the Ohio Pharmacists Association and the current president of the American Pharmacists Association Academy of Pharmacy Practice and Management. And she is a board member with that organization as well. So with that, Cathy, I'm going to turn this over to you if you want to introduce your other panelists.
Thanks, Alex, and welcome everyone. I'm excited to be here. Want to first introduce two panelists that I've asked to join me today. I really wanted to bring their expertise and experience as well to this presentation. Wendy Edgar is director of the community at Updox, where she previously spent over 5 years working on product solutions, as well as driving the success of the customer base. Wendy has spent her entire 15-year career in healthcare IT, and then prior to Updox, she worked in account management and business development for Cerner, focusing on their post-acute solutions for improved patient care and reimbursement. Wendy has a BA in speech communications and political science from Muskingum University. I'm also joined today by Andy Gila. He's the director of product management at Updox, where he also previously led product efforts for patient engagement and telehealth solutions. Prior to Updox, Andy served in product management roles for Explorus and IBM Watson Health, with a focus on data analytic products for population health, provider, and payer markets. Andy has a BS in Health Information Systems from Ohio State University. So welcome, Andy and Wendy. Thank you for joining me today, and welcome all. So I'll go ahead and get started with the presentation. So we decided to talk about the 5 predictions for the future of healthcare, and really excited to share just some background of what we think is going to come with healthcare, and then ask you as panel, feedback from Wendy and Andy with their experiences, what they think about each prediction. So it's no doubt that we've seen that pandemic has changed the way that healthcare is delivered. And even after the ease of restrictions and hopefully reopening eventually, healthcare will definitely not return to business as usual. A new precedent definitely has emerged. And as we look ahead, we'll continue to transform at a rapid pace. So like I said, today we'd like to take a glimpse into the future and highlight the 5 predictions for the future of healthcare, and think about how this will impact your practice's virtual care strategy and future growth. Again, I'm joined by Wendy and Andy, and I really appreciate their expertise to this conversation. Our learning objectives today are to review current evidence calling for practice transformation in a virtual care strategy, defining key components of a virtual care strategy, identifying opportunities to transform your practice with technology, and discuss how a virtual care strategy leads to long-term revenue for practices. So prediction 1, I think this is probably no surprise to anybody, but number 1 being telehealth is here to stay. So American Telemedicine Association defines telehealth as a collection or means or methods for enhancing healthcare, public health, and health education delivery and support using telecommunication technologies. Telehealth encompasses a broad variety of technologies and tactics to deliver virtual medical, health, and education services. We've seen a number of benefits to telehealth, which are on the next slide. Thank you. So we've seen a number of benefits, including improved access to care, which has been critical during the pandemic to extend the reach and expertise of healthcare providers, cost efficiencies with better management of chronic diseases, reduced travel times, and fewer shorter hospital stays, improved quality with studies consistently showing that the quality of healthcare services being delivered via telehealth are just as high quality, and increased patient satisfaction by meeting their consumer demand as telehealth reduces, again, travel time and related stressors as related to going into the office. And as we looked at telehealth and its benefits, truly a benefit has been in the pandemic. And so you can see that telehealth was called on as a critical and safe management of patients. And this was just a quote that Dr. Patrice Harris, immediate past president of the American Medical Association, had provided. But we all know this, that COVID definitely changed how we deliver care, and telehealth really, accelerated during this time. Unfortunately, what we saw is that during the pandemic, a number of flexibilities for telehealth were implemented, which minimized the challenges that we previously had experienced and increased adoption dramatically. So some of these examples of flexibilities include HIPAA flexibility, telehealth waivers from CMS, making it easier for people enrolled in Medicare, Medicaid, and the CHIP program to receive medical care. Expansion of qualifying sites such as FQHCs and rural health clinics. Cost sharing for patients in federal or healthcare programs being reduced or waived. And then, of course, a huge game changer was the billing and reimbursement updates occurring broadly in private and public insurance plans. And we saw, because of these flexibilities and the critical need to adopt telehealth, just practice adoption soared. If you just think back even 4 years ago, American Medical Association did a survey to their members, and they found that only 14% of the respondents reported using telehealth at that time. And then fast forward to even 2019, just 1 year ago, AMA reported that only 50% of physicians were using or planning to use telehealth. And so now, by no surprise, we're seeing that since the pandemic began, adoption has soared. And according to our Updox customer survey, then this was just back in May, 94% of our practices were offering telehealth. But not only were practices adopting, the patients were adopting and seeing the benefits. So just a couple patient stats is that recently CMS shared that 10.1 million Medicare beneficiaries have received a telehealth service. 43.5% of Medicare primary care visits in April alone were provided via telehealth. And then 34.5 million Medicaid and CHIP beneficiaries have utilized telehealth. So that is, nearly 50 million patients just from the Medicare and Medicaid CHIP population that are utilizing telehealth. And then overall, just look at patient adoption is that a Harris poll indicated that 42% of US adults use telehealth since the pandemic first began. And we, of course, see that number continue to rise. And patients are really liking telehealth. They like it because it's more convenient. And you can see that 65% of patients had reported just being able to have that convenience was really, really beneficial for them. And another 63% said that it's because they like telehealth because they don't have to worry about being exposed to sick patients. So, of course, during this time, safety and social distancing is critical, and so telehealth goes nicely to help ensure patients stay safe and still receive care. We've seen practices adopt telehealth and really adapt them well to a few different visit types that really dominate. So medication management. So me as a pharmacist, I've seen medication management and also have heard and spoken to many practices that medication management is such a great way to offer telehealth because often it's, titrating doses, following up on response to the medications, and may not require that physical assessment. Chronic disease management as well, just continuing to follow up on different aspects, maybe of diabetes, hypertension, etc. And then sick visits, so more of those minor and mild ailments that may not require an in-person visit, or perhaps potentially triaging to see if an in-person visit is necessary. And then there's been populations that seem to benefit more with telehealth, or just, telehealth has been a better fit for. So really generally healthy patients, patients with chronic conditions, children, pregnant women, geriatric patients, and behavioral health. And like we said, we've seen telehealth be quickly implemented by practices during this time. And this is just a graphic from the American Academy of Family Physicians. But thinking about the different steps of implementing telehealth services, this was done just quickly at a rapid pace, and we'll continue to evaluate, what's the best for your practice. I think for me, the key parts to this is that, it's if anybody's heard of a PDSA, it's a Plan, Do, Study, Act. So it might take several cycles to get it right, but telehealth adoption was very, very quick. We got patients to adopt really quick, but it's going to be a continuous improvement process as well, as we continue to refine what's best for our patients, but then think about what technology enhancements as well come out. I think you guys know that the biggest concern that people have is telehealth really going to stay? But these are just a few examples of federal bills that are actually out there regarding telehealth. And there's been a huge push, not only from the industry, but just legislators as well, around telehealth. So I think it's fair to say, with just the presence and the benefits that people immediately seen, and again, all the number of bills out there, and this is by no means a laundry list of the bills, this is just a small snapshot of them, but we can definitely expect telehealth to stay throughout the future. So now I'm going to invite Wendy and Andy to join me in the conversation. And what I'd like to hear about first from Wendy is to tell me a little bit what you saw as far as practices approaching telehealth implementation and expansion.
Yeah, thanks, Cathy. I think what has been interesting from our specific customer base, and then just following the industries around healthcare, is that everybody knew they wanted to get a telehealth strategy up and going at some point. And this was into mid last year, towards the end of the year, going into 2020. Telehealth was widely talked about, and everybody kind of understood the importance for the future. I think what the pandemic did, and this isn't news to anyone on the call, is force all of us to emerge and evolve. So what was interesting about the telehealth strategy, because the pandemic pushed forward that the need out of necessity only, we had customers that were implementing within 24 hours. So something that would have taken, months of planning, a change management plan, how we're going to get on board, how we typically like to implement solutions, especially in larger organizations. We had, one example is we had a regional medical center in San Antonio that called us on Saturday morning, right when they were shutting down their doors from inpatient appointments, and we got them up and running by Monday morning. So with a less than 24-hour turnaround, they had over 20 providers offering telehealth as a means to see patients. That was important. And we have thousands, not to exaggerate, but thousands of stories like that within our customer base, and know that that's the common story with the pandemic. What's been interesting with the adoption is kind of after the initial surge of the pandemic, as customers and practices nationwide started to open their doors to in-office visits, get back to this new normal that they're experiencing, telehealth continued to really be a driving factor for a lot of our customers. Many of our customers, the same customer I mentioned in San Antonio, as well as a few other of our critical access hospitals, and multi-physician practices, are using this now as a secondary business line. So instead of just the reimbursement from in-office appointments, they really see this as a strategy to help drive their business, and more importantly, to help drive patient care, improved outcomes, and make sure that they're not missing out on providing the exceptional care that they need for patients, but also making sure that they're not missing out on revenue that they would have generally had with in-person visits. And that really, you know, what we're hearing from our customers is the telehealth offering, there's obviously some cost involved, but they're finding that the soft cost is lower in terms of time, in terms of the safety precautions that are needed for in-office visits now with PPE and just the rising costs that it takes to have patients in the office. It drives additional revenue while keeping those costs low.
Thanks, Wendy. It's really interesting to hear about it as being a secondary business line for practices. So definitely seeing that emerge as well. Andy, now I want to hear your perspective around telehealth. So now we heard that a majority of practices have adopted telehealth in some way or another. What do you predict for future expectations from a product perspective?
Sure. Thanks, Kathy. You know, like you mentioned and Wendy mentioned, I think in general, the continued expectations will always be, you know, ease of use. Anything that's overly burdensome and requires, you know, too many hoops to jump through or friction for, you know, either patients or end users, you know, those will not be the products that really will proliferate, but it's going to be those that promote ease of use. But for me, it's really, I think, an indication of just, you know, the expansion of access either in synchronous or asynchronous models. I think telehealth is just, you know, an example of it, but I think we've also seen the pandemic bring to light other forms of virtual care and patient engagement, you know, such as HIPAA compliant texting. So, you know, for me, I really think it's going to be interesting to see how the product portfolios of, you know, various health systems, vendors, et cetera, grow to meet the needs, you know, because patients have always had consumeristic expectations, you know, retail, banking, et cetera, have always driven, you know, forward what people expect out of interactions when it comes to, you know, digital interactions. And healthcare was always woefully behind, partially because, you know, there was never a real incentive to overcome some of the regulations. And I think the pandemic has accelerated the industry forward quite a bit. So personally, you know, I think we're going to see a continued rise in those types of solutions to provide better access, you know, better patient experience in general. And I think it'll be interesting to see the impact on reimbursement. I know you mentioned, you know, there's a lot going on with telehealth reimbursement, and, you know, it'll be interesting to see what sticks, what doesn't, and what changes come out of there. I also think this will be a good testing ground over the next few months to see what kind of reimbursement we can expect in the future when it comes to other synchronous and asynchronous models of care, like texting and other types of outreach. So definitely something to keep an eye on.
Thanks, Andy. So I think what I'm hearing from both of you guys is that, again, like telehealth is here to stay. You know, there's some details we're still needing to work out. Practices are doing a great job evolving with this. But what I'm also hearing is that the in-person and the virtual or the telehealth type of visit, those will exist together. And so it's important for the practices to think about a strategy that matches and it's easy for the practice to adopt that will have both in-person and virtual care. All right, well, so I know we've talked a lot about telehealth, so let's go ahead and think about the next prediction. So telehealth is just one piece of that puzzle, but prediction number 2 is patients will avoid care. So we have known for a long time that no-shows have always been an issue and a priority for practices, but now more so than ever because of the social distancing, the fear that patients have, and then potentially even practices being closed or limited in hours, patients are avoiding that care. So Wendy, if you go to the next slide, and this is just pre-pandemic. We knew, again, like patients were missing their appointments, and we can see those top reasons that they were missing of those appointments were that they forgot or didn't have a reminder call. They had those personal or work unrelated issues, problems with transportation, potentially too sick to come, and problem with insurance. So we talked about telehealth being a potential way to like help with some of these, but again, there's some other strategies as well to think about helping with the missed appointments. So just looking at some numbers about patients avoiding care, 70% of clinicians experienced a greater than 50% decrease in patient volume during the COVID-19 pandemic. So this was, obviously an issue not only from the business aspect, but certainly from the patient outcomes aspect. And something alarming was that 12% of clinicians said that, and this is in the oncology space, that only 12% said that their routine check-ins with cancer survivors were happening as usual. So I know one of our speakers later is an oncologist from Ohio State University. So I'm interested to hear his perspective on how oncology has changed with telehealth. And then just in general, a majority are reporting that follow-ups around common chronic diseases such as lung disease, hypertension, and diabetes were just happening very little or not at all for their population. And 60% of clinicians believe that some of their patients will experience avoidable illnesses both due to diverted or avoided care. So, I don't think that these statistics really surprise us, but at the same time they do, because these are huge numbers. And, what's scary about it is that these aren't just patients, this is all of us, right? And so the long-term consequences, we have to worry about that. So we need to make sure not only from the practice perspective, we want our patients to be healthy, but we really want our overall population to continue to be healthy. So we need to think about different ways to improve visit rates. A few just bullet points on doing so are to making sure you assess that no-show problem. So again, we talked about there are some specific issues that we see around no-shows, but I think it's important for each practice individually to assess what are the driving factors of their no-shows. Making sure that you prioritize patient accessibility, thinking about not only extended hours or weekend hours, but also thinking about, again, telehealth being a way to prioritize that accessibility. Continuing to educate patients on the importance of visits, but then also increasing internal awareness and attention. So making sure that the staff and the practice know the importance of these visits and how we can help play a role educating the patients. And then lastly, just adopting specialized flexible approaches. So I think that just improving visit rates there's no one size fits all strategy, but there are things that, we shouldn't treat each patient as the same. So we need to be able to have kind of a toolbox of options and think about what are the ways that are unique to my practice that I can help improve visit rates. So I'm gonna call on now Andy and Wendy again for some perspective from. So Andy, I wanted to hear about how have you seen practices leverage technology to improve their visit rates?
Sure. And I think a lot of it goes back to what you just talked about, Cathy. In order to leverage technology, you first have to understand what you're trying to solve and kind of what those main drivers of no-shows or why patients are not coming to visits. And once you can understand that, right, it could be anywhere from the patient simply forgets. I know I'm guilty of that. And then you also have to understand what's the best way to engage your patients. So for example, if a large portion of your no-shows or patients are forgetting, you can leverage technology such as automated appointment reminders to conduct outreach to them. But how you implement that, how you go about it also is important, because if a majority of your patients prefer to text, for example, it might be more beneficial to you to leverage that kind of approach to remind a higher percentage of them. I know personally I'm guilty. If I get a phone call and it leaves a voicemail, I'm embarrassed to say this, but I literally have over 300 unlistened to voicemails. So that's not a great way to get a hold of me. Now, each patient is different, so it's important to kind of understand your patient demographic. But automated appointment reminders are a really low-hanging fruit type of approach to help address that. And then other types of issues might be, lack of access or, lack of mobility or access to transportation. And that's where leveraging telehealth or other types of virtual care can come in handy, because it really becomes a problem of access or inconvenience. And any way to make, leverage technology such as, virtual care and telehealth can provide additional access, whether it's, outside of traditional office hours, whether it's to people who have lack of access to transportation or might just be, in rural areas that it is really inconvenient for them to do it. Those are just some of the ways. And I think it's important to know, you're never going to solve 100% of the reasons, but the 80/20 rule is a good approach, that if you can just pick out your top 2 or 3 drivers, typically that's going to let you tackle about 80% or so of those no-show rates. And again, it's not going to happen overnight, and it's important to understand what those problems are, or kind of drivers for it, and use technology to address the drivers, because there's definitely no magic bullet, no magic solution, but a little bit can definitely go a long way.
Thanks, Andy. And before I switch over to Wendy, I actually have another question for Andy. So we talked a lot about patient reminders and kind of like reactionary to patients who've already scheduled or sought out care. But, do you have any thoughts around the patients who, we just haven't even been in contact with? Like, what are other ways that we can reach out to them and get them re-engaged in their care?
Yeah, absolutely. I mean, that's a great example of kind of identifying a cohort of patients that maybe has gone a long time without a visit, or might be overdue for their annual wellness exams. And cohort messaging or broadcast messaging of patients is another effective way. I mean, whether it's generating a patient list of those that are overdue for a wellness visit, it's something that could also honestly be really effective for care gaps, where you can mass target a cohort of patients. And again, that's where the technology can come in handy, because there could be a variety of ways to target them. Some might have different preferences. The EHR might actually capture some of those communication preferences. So that's a great call out, Cathy, because that's another, low hanging fruit, but extremely effective way to engage mass cohorts of patients that you might be trying to drive into the office, or just push educational content. Flu shots, are in season. So that could be another great example to let patients know as well.
Thanks, Andy. Yeah, I think it's critical that, especially with the push for preventative care and just, with the value-based care movement, and we should have been doing this for a long time, is that not just reacting to the patients who don't show up, but it's thinking about how can we target our population or care for our population as a whole. Now, Wendy, I want to hear, I've been hearing that practices that there's actually practices that their patient volume grew during the pandemic. So I wonder if you could provide some insight into that.
Yeah, absolutely. I think actually what's interesting about all their predictions is how well they play together. I would say they kind of come at moments and times for customers and providers in the industry. This is the main topic I'm hearing right now. This is the number one conversation that's happening, and how we get patients back in the doors to ensure that they're, resuming their healthcare plans. So a few examples that I've heard on growing patient populations, whether it be getting their existing, population back in front of the providers for care, or it is patient acquisition in this growing time, has been kind of what Andy had alluded to, utilizing and leveraging technology that's easy to implement and use to think about how to get patients back into your practices virtually or in person, with a one-to-many approach. So being able to the cohort messaging that Andy had talked about, anytime you can efficiently get in front of a patient, your existing population with a one-to-many approach, it's just going to be easier, whether that's text messaging or emailing or even phone calls, anything that can be automated to help promote care that's needed. Is just going to help organizations run a little more efficiently. That's also going to drive some patients calling in to get those appointments scheduled, whether it be telehealth and or in person. The other thing is just the ability to see more patients with telehealth visits. So, having things, we have examples of some practices putting all of the paperwork with online forms on their website, where if I'm a new patient and I'm searching, which I think most of us know, a lot of the population is Googling, physician in my area. Just having website accessibility for people when they're exploring the practice, to be able to easily inquire without picking up the phone, because so many people do, like Andy's 300 missed voicemails. So many people don't want to pick up the phone to call in a busy world. So just finding ways to, again, make it easy for new patients or existing patients to contact the office, whether it be through mobile means or online presence. And then also just offering a variety, like you said, it's not a one size fits all approach that our customers are doing. It's let me provide the care in the way that's best for that patient. What I also is interesting, I think there was a question posed in the chat around special accommodations for the digital divide, excuse me, whether it be elderly, when you're talking about this telehealth and different options. I think what's interesting is that tends to be a barrier for delivering care with technology and emerging technology such as telehealth. But what we have found overwhelmingly the last 7 months is that the digital divide is much smaller than originally thought in the industry. And, for, like Andy said, 80, I would say for 90 to 95% of the patients that most organizations serve, they feel comfortable with digital now just because it is so relevant in our personal lives outside of healthcare. So having the ability to add multiple people to a telehealth visit, so a loved one, a family member, a social worker can be present, that just helps ease that fear for patients. And anytime you can give patients the security that you're bringing them in safely, whether it's in person or virtually, that you're providing a safe healthcare environment for them. We're finding that's working well for our customers, and they're actually growing their patient acquisition at the moment.
Thank you, Wendy. Yeah, I think, both of you guys, all the different tactics that you had mentioned. One other thing that I would mention is that like word of mouth has just gone a long way. I've heard, I was recently talking to a practice manager from Oregon at a family medicine practice. And she had said that, in her area, some of the practices had not adopted some of the technology that was needed during the pandemic. And patients, didn't feel comfortable going into the practices at that point. And so they heard about this practice instead from their friends and family. And so a lot of the patients surprisingly transitioned care during this time just because they really wanted to be at a practice that was on, thinking ahead and on top of things. And surprisingly, I think the same way, my family medicine doctor, I was really taken aback that there was not really any messaging about what services were offered to me. And so that just makes me second guess if they're really engaged in my needs and my care. So, but I'm very happy to see that my pediatricians have been very, forward thinking and reaching out for my kids' care. But I think that personal touch and that customization and thinking about what can you do to still engage with your patients is important to make sure that they're not avoiding care in the long run.
I think one more thing too, Cathy, is that personal care is absolutely what we hear. And I think all of the people on today's session can agree. I think that the concern sometimes is that technology will feel cold and take the personalized touch out of it. And that's where technology has really evolved and really started to make it feel, whether you're sitting out one-to-one and sending that out, or regardless of how it's sent, it's personalized, it feels directly from the physician, from the practice. So there's ways to lessen that cold approach that maybe technology had a bad rap for in the past.
Definitely agree. Thank you, Wendy. Thank you, Andy. So we'll move on now to the third prediction, which is waiting rooms will disappear. So if we go to the next slide, these images probably all look familiar to you. So obviously posters requiring patients to consider if they have COVID symptoms, spacing out in the actual waiting room with chairs, and just signs to continue to maintain social distancing. So I think by no surprise, you guys have seen your waiting rooms evolve with the pandemic. But if we think about waiting rooms in general, it's always been a very unpleasant experience from a patient perspective. So in fact, the 2019 Qualtrics Industry Pain Index reported that unpleasant waiting rooms were the single most cited reason why patients said they would stop returning to a healthcare facility whether it's primary care, emergency room, or urgent care. So to me, it seems like it's long overdue for the waiting room experience to transform. And with the pandemic and the needs for social distancing, it's even further escalated that need to eliminate waiting rooms as a whole. So if you go to the next slide, Wendy, I just wanted to share, I found this very interesting study from Dell Medical School at the University of Texas at Austin. And they had, already had begun the process of eliminating waiting rooms. And this was pre-pandemic. And they really thought of it as that opportunity to transform the patient experience. And you can see here, for patients and family, the feeling of wasted time alongside others who were ill was a source of frustration, anxiety, and reinforced the prioritization of the system's needs over the patient's. So on the next slide, we've seen the waiting rooms definitely change with technology as well. So I know I showed some of those physical signs of distancing. For me personally, I've had a lot more like text to check in and say that I've arrived. And this is just an example of some of that, what we've seen as we new workflows that practices have begun to adopt to eliminate their waiting room. So just as an example, you can see, again, like when the patient arrives, instead of going into the waiting room, they actually are starting to check in via like a link or a text or an email. So indicating to the practice that they arrived, but remaining in the car, and then perhaps doing their screening questionnaires or any type of paperwork ahead of time, or more so electronic paperwork now on their phone in the car. And that again keeps them in their safe space, but then also makes it more pleasant experience for the patient, because they're not in that physical waiting room, perhaps like they said, surrounded by sick patients or just general sometimes chaos that waiting rooms can be in. And then the practices are also able to receive information now electronically or digitally with forms. So that's been a interesting experience to see practices start to leverage that. And then the patients, instead of being, when they enter the practice, they're no longer going to the waiting room. They're actually being roomed right into their actual patient exam room. So again, this is just an example that we've started to see, as far as we continue to adapt that waiting room experience. But I want to hear again from Wendy and Andy. So Wendy, I'll start with you now. Is that tell me about what you've heard from customers about eliminating their waiting room and how the practices and patients have adapted to that type of change.
Yeah, definitely. I think what's interesting is the waiting room concept was not patients' favorite experience when coming into a provider's office. So I think patients are a little bit celebrating the added convenience of not sitting in a waiting room for all the reasons that you shared. I think what's happening in practices is a little bit of what do we do without waiting rooms, right? This is the way we've had patients come into our practices, our organizations for as long as everyone's been in healthcare. So I think when we think of waiting rooms disappear, it feels really scary. It feels like of all the technology I have to adapt in the current moment of the healthcare spectrum, this feels the scariest to a lot of our customers or to practices nationwide. I think it's little ways to keep your patients safe as they're coming into practices is what we're seeing the most. It doesn't have to be this huge overhaul of a waiting room. It's finding what works best in small ways, such as let me think about the forms I hand via paper to patients. So we limit the contact we have, passing pens, passing clipboards. Can I make some of those online or digital for the majority of the patients who will do that pre-visit, get the information ahead of time? Am I able to for a certain population, allow them to text me when they come to my practice so I can room them right away without them waiting in the room. I think there was a question, what if someone takes a bus and they're not in their car? We have customers that are in super urban areas where a lot of their patients are taking public modes of transportation. They can, typically still have a mobile device and can call or text while they're on their way. So I think it's a strategy for different areas of your population. And then afterwards, how do we get the patient out of the practice without coming into exposure with other patients, just to limit that face-to-face contact? So that's how we hear most of our patients kind of handling, is finding one or two small ways with technology to limit the exposure in the waiting room. And then we have a couple who have completely done away with the waiting room. So I think it's finding the strategy that makes the most sense right now, that you can ease your way into this. But I think everybody right now agrees that waiting rooms are, as we know them or knew them, are disappearing.
Thanks, Wendy. Now, Andy, I'm going to ask you, what have you heard about some of the key things for implementing, or I guess getting rid of waiting rooms for practices, and what are some of the barriers or hurdles that they've experienced along the way?
Sure, thanks, Cathy. And again, I just want to reiterate, while waiting rooms will disappear, right, it's not going to happen overnight, and it's important to understand that when implementing any solutions to help drive or reduce the needs for them, what are the reasons you need a waiting room? What are the reasons why they're necessary? And understanding how that factors into the patient experience. Speaking just for myself, right, as a patient, I don't mind if I'm in a waiting room or waiting if it's the physician who's running later. I do mind if all of a sudden I'm giving all this paperwork or things that could have been done ahead of time that is now not only eating into my visit time, but then is going to delay everything else. So, understanding those reasons of like why is a waiting room a necessity for your organization, and how can you tackle that? So whether it's, providing a text message the night before with a link to all the forms in a digital version to fill out the information, like you guys mentioned, or whether it's, asking people to wait outside to reduce exposure. It's also important to understand, this is personally where I think social determinants of health and other types of information about the patient is also going to become really important, because those can definitely be some of the barriers to implementing these types of things. I know someone asked a question about if you have patients that are taking the bus that Wendy spoke to. Even if you're somewhere where not only are people taking the bus, but the weather isn't great right now, like, do you want people waiting outside in the rain? So those are all factors to kind of consider as you're doing it, and understanding how can you provide a great experience to reduce the need for waiting rooms as much as possible. But again, it's not a one size fits all, and it's important to understand, what are the few steps you can take today to make the patient experience better, to collect and streamline some of the information you need today, and then over time grow upon it, because technology will continue to improve. The opportunities to make that patient experience will continue to improve, but it's definitely not going to happen overnight. But it's more important to take a step now, and so over time it becomes this incremental progress rather than trying to tackle the whole thing at once.
Yeah, just to add that to that, Andy, another thing, because it doesn't happen overnight, that I meant to share was, we get the unique experience of dealing with a lot of different practices, physicians, ways of doing things. Some maybe aren't so successful in the beginning and they got to rethink it. But I think the majority, it's letting your patients know what to expect when they arrive ahead of time too. There is this fear, maybe is a little too strong of a word, but this unexpected, I as a patient don't know what a doctor's office looks like right now in our current pandemic and after the initial rush. So it's making sure there's ways to get in front of your patients ahead of time to ease their fears, ease their concerns, and make them feel very comfortable that you're still going to provide the same level of quality care while bringing them in safely.
Thanks, Wendy and Andy. We'll go on to prediction number 4. Looks like we're having some great discussions, so I don't want to limit it, but I also want to make sure we have good questions from the audience that we can answer. So prediction number 4 is virtual collaboration will improve care fragmentation. So we've talked a lot about that patient experience. So now thinking about how technology plays a role with that provider to provider collaboration is key. So prediction number 4 is really highlighting that. So we really know that there are unintended consequences to inefficient care or poor care team collaboration. So fragmented care in general leads to higher costs and lower quality. And you can see there are a number of studies out there in the literature that already point to this. But just you can see the listed on the slide, the unintended consequences. And really the approach has now been a push to view healthcare as a whole rather than individual instances in time, and personalization and relationships with providers working with each other as team members. And then a sense of professional and shared responsibility amongst colleagues. So if you go to the next slide, Wendy, so I just wanted to provide just two emerging models, and they're not really emerging. They're here now around provider to provider collaboration. So one, which is called Project Echo, you might have heard of. It's Project Echo, which stands for Extension of Community Healthcare Outcomes. And what it is an innovative telemonitoring program designed to create virtual communities of learners and bringing together healthcare providers and subject matter experts using video conference technology, brief lecture presentations, and case-based learning, all really fostering that all learn, all teach approach. And so you're using, again, that technology as a way for providers to connect to each other. I know Dr. Ujwal Ramtekar, who is speaking at 11 o'clock, he's an expert at this field and he's a leader in this field. So I'm not sure if he's speaking on this in particular, but I know he's been one of those change agents and advocates in the industry for this adoption of the Project Echo. Next slide is an example of the clinician communication using something called e-consults. Again, leveraging technology, but what e-consults are is that it's an asynchronous exchange initiated by a primary care doctor between a specialist colleague. So instead of an in-person visit, what the PCP will do is actually reach out to the specialist using that technology for a consultation before potentially, referring and then hopefully avoiding a referral for the patient to that specialist. And so what there's again studies that have shown that dollars and time spent or saved for patients and just the healthcare system has been tremendous by adopting this type of approach where patients in the end really benefit because they avoid potentially unnecessary care, and then the primary care physician can really help leverage the expertise as a specialist through technology. So I want to go ahead and go back to the panel. So Andy, I want to hear from you. How have you seen providers utilize technology to collaborate with each other?
Sure, yeah, and I think you spoke to some of those examples, Cathy, which are have been really effective to drive that adoption. And really, there are a few different ways to go about it. The EHRs, for example, have great opportunities built in to facilitate a lot of those workflows, especially if you're within the same health system or the same instance. There's a lot of opportunity to leverage what's there, both to better collaborate around referral management or just provide care and bring in the whole care team when it comes to a patient. When you start going outside of those instances where there might be different implementations of different technologies, it's important to find the lowest common denominator to still encourage streamlined referral management, streamline access to the whole virtual care team or the in-person care team to help support around the patient. And we're starting to see things such as HIPAA compliant secure texting or secure email, ways to communicate that physicians, clinicians, really the whole ancillary care team and others can leverage their own personal devices, still be engaged in a HIPAA compliant manner, but not have to go through the burdens of either being added to different systems that they might not be comfortable with, having to worry about VPN access, app downloads, etc. So I think it's a really good timing with where technology is going and some of the recent things that have emerged where I think we'll continue to see that where it makes sense, continue to use the system investments that are in place. And then when that becomes, difficult, especially as you're trying to move across different organizations and still provide that great patient care, I think just, video, texting, email, when done in a HIPAA compliant manner, are going to be some of those things that continue to emerge to help facilitate for better, physician to physician collaboration and consultation, a care team collaboration, referral management, just some of the things that you mentioned. But, really, I think that's a big opportunity for us all moving forward.
Thanks, Andy. I'm going to go ahead and move on to prediction number 5, which is practices will be paperless. So if you go to the next slide, Wendy. So in 2017, the CMS administrator Seema Verma launched the Patients Over Paperwork initiative to help patients by allowing doctors and non-physician practitioners to focus on patient care instead of paperwork. And she really called for this transformation in patient care, improving communication and data exchange, and challenged the healthcare industry to be fax-free by 2020. I think it's very clear that it's 2020, and 2020 is definitely not the way that we expected it to be, but it is not paperless by any means. And so, we're really seeing that the cost of paper really adds up. So just an example, for every 5,000 pages, $162 go into just some of the physical needs of the toner, the actual paper, and the fax line. And then that doesn't even include the actual time that it takes to fax. So in average, it takes about 2 minutes per fax, or 55 hours for that 5,000 pages potentially. And then another thing is that we talked about that paper has not gone away, but what we're seeing now is that paper is very much so in existence. So just some recent numbers is that more than 9 billion faxes are still sent every year in healthcare, and fax still accounts for 75% of all medical communication. And this doesn't even account the paperwork that we talked about that occurs like in the waiting rooms, or just the paper that the patients are actually having to fill out or potentially bring. So there's an opportunity to switch that paper to more electronic or data collection. So just a couple examples of administrative and clinical paperwork that we've begun to see practices switch from not only from that paper, but to more of a electronic form. So you can see the new patient information, HIPAA release, financial policy, etc. But practices are also really taking advantage of that. Electronic is a great way to collect additional patient information for clinical needs, such as screenings and assessments. So if you go to the next slide, Wendy, you'll see here are just a few codes that and potentially billing and revenue opportunities for practices that we could be leveraging to not, like I said, collect that patient information that is critical for the visit, but also potentially capturing revenue for your practice. So a number of some examples here are just even the patient health questionnaire, or the PHQ-9. We've seen the ADHD visits, ADHD Vanderbilt scales being used through here, but again, and a big clinical assessment that practices have done is actually COVID screening questionnaires. So I'm going to actually now go back to Andy and ask, what does a paperless practice mean to you?
Sure. Thanks, Cathy. Really, a paperless practice, to me, it's really just more of an indication. And again, I don't know if truly paperless 100% is ever quite possible, but I think it's a goal to eliminate as much of it as possible. And it's really just a good indication, in my opinion, of practice transformation, because there's a lot of information and manual processes that's associated, with paper and the paper processes that get driven as a result. So whether it's people's time spent scanning in information, getting it to the right place, or sorting it, but also the data that's trapped in there. I'll use two quick examples, right? And you alluded to one with being able to take screenings and other types of questionnaires, push them in a digital manner, which then, you can use where it makes sense, digital scoring and just better routing of getting that information where it needs to be quicker with, added insights. But if we think about all the different, you mentioned just how much fax volume, it still blows my mind to this day, but, all the data that's trapped in that documents that are flowing via fax. There's tons of emerging insights and technologies when it comes to, OCR, optical character recognition, and machine learning that can be paired with that. Today it could start with just being able to better classify what's a prior authorization, what's a lab result, et cetera. To tomorrow, taking some of that unstructured data, pulling out discrete elements and placing it where it needs to go. Now, obviously, that's not going to happen overnight, but the technology is more ready than it's ever been before. But in order to get there, it's important to start moving away from paper and digitizing a lot as possible. So to me, paperless is always just a good indication and a good goal to strive for some of the other value that can be layered on top of digitizing a lot of these processes.
Thanks, Andy. Now, Wendy, I want to hear from you. So, why are practices deciding to go paperless?
Yeah, and I'll try to make this short due to time. The reason to go paperless is all around office efficiency and reducing costs. So what that means is, of course, there is a dollar amount to a ream of paper. We have a neurology, a group in Augusta, where they were using up to 3 to 4 reams a day of paper. With going more digital, they're down to 1 or 2 a month. So there's definitely some hard costs in that you've already shared. I think the efficiency, so what's the information on that paper, a lot of patient care that's needed to get in front of the providers quickly. So finding that in a way that we can have not only patients fill it out without paper, with getting the forms that you've talked about. Other things that we've seen is what is the time suck of phone calls? I'm calling in to leave a voicemail for a prescription request. If I direct patients to my website to do that same thing, that same neurology group, they've seen a decrease in voicemails of 50% while going to more of a electronic process, as well as the callbacks reduced by 75%. So just the operational cost. And then the flip side, and what everybody I think is here for, is to provide the better patient care. So the quicker we can get information in front of the physicians, whether it be in a digital format or just we get it from the patients quicker, or from the providers, or referrals quicker to get in front of those providers, is important. I think there was a question that was posed around get patients that take Uber or Lyft. How do we talk to patients about how they're coming into our office to eliminate waiting rooms and get those things? I think that's another piece of paperless, because you can do a lot of things that's specific. You can ask your patients ahead of time how they'll be arriving. Will they be bringing themselves public modes? How will they be coming in? That could be a form that you text out to them in advance. And then, you may call them to make sure they know how to do that. But I think those are all just ways of being a little bit more efficient and providing that one-on-one patient care that's needed.
Thanks, Wendy. And I know we're wrapping up now, but I really enjoyed the conversation and hearing your guys' feedback. Just to think about all these different solutions and technologies that are emerging, we're also seeing the pain around the lack of integration and these systems talking to each other. Even recently, last year, we had a survey around this, and this was reported the #1 frustration in healthcare practices regarding technology. So what we're seeing now is that practices are, again, looking at what is a virtual care strategy. So a lot of times people think of telehealth, especially since we quickly adopted telehealth as our virtual care strategy. But virtual care really means what your practice has pieced together, and really hopefully mapping that out in a way that the solutions are all working together. So hopefully you have learned from, examples of how different practices are experiencing and approaching their virtual care. I think you've heard very loud and clear, there's no one size fits all, as well as it is just incremental change. So it will not happen overnight, but there are a whole endless list of ways that we can continue to advance healthcare to make your practice better. And so we're excited to be part of that conversation. And we thank you guys all for participating today. I know we just have a couple minutes, but if anybody had any other questions in the chat, I'd think I see some right now. Let me get see if Wendy or Andy want to respond to any of it.
Cathy, I think there's a good question around regulations and bills focusing on telehealth. And the question is, with that being said, are there concerns that you have related to more rigid regulations that would make telehealth a less viable solution for providers, making it easy to a much more complicated and expensive process? And secondly, do you anticipate an increase in telehealth adoption with new regulations?
So I guess for the first question, I do think that like payers have, I've had a lot of conversations with payers, as well as my previous role was more directly working with payers. They see telehealth as a way to obviously reach their patients and help with that actual member engagement. But as well is that, payers also, a big priority for them is utilization management. So if practices or patients are not receiving that high quality care that they're expecting patients to receive, then there might be some more rigid, I guess, restrictions put into place. But I think that's really up to us on how we do with delivering that care. And at this time, I think in general people are very, very thankful, and so I don't anticipate more rigid restrictions. I really think it is, hey, how can we continue to benefit from the care that telehealth provides? And I think, Andy, did you want to jump in for the second one?
Sure. Yeah, there was a question regarding, upcoming legislation and telehealth adoption. The question was, along with new regulations, is that going to force healthcare systems that are utilizing disparate systems to really consolidate on a single enterprise solution? That's it's a tricky one, but I don't think so. I mean, we oftentimes see, especially with larger enterprise customers, that they're leveraging multiple telehealth solutions because of a few different reasons. One, redundancy. If something ever goes down, you need to have something else that can provide and facilitate visits. Now, ideally, a lot of vendors are investing in redundancy themselves, but there's no, foolproof way to avoid it currently from what we've seen. And then additionally, it's going to come down to user preference as well. So those are just some of the things that, while there definitely is a push there, I don't think it's going to happen anytime soon, personally. And I know we're at time, so I'll kind of pass it back over to you, Cathy.
Thanks, Andy. Yeah, so we are at 10 o'clock. I know that some of you might have some additional questions, but feel free to contact us. You can just say that you're participating in this webinar, and we'll get that email through info@updox.com. But like I said, we're really excited to be part of this conversation, and we're happy that technology has quickly accelerated, but also have really helped healthcare during this unprecedented time. So thank you again, and I'm going to turn it back over, I think, to Alex now.
Yep. And thank you, Cathy and Wendy and Andy. I really appreciate it. That was a great discussion, great predictions for the future. And I know we're already at time, actually a couple minutes over, but my own 2 cents, if I can add to that, it'll be interesting also, again, to look back at 2020. For those of us who have been in healthcare for quite a few years, we often refer or have talked about, looking at other industries and learning from, banking and others. But it will be interesting to see some of what you suggested here might even be things that healthcare has advanced enough in the last several months that might be things that other industries start to adopt. And your virtual waiting room conversation, et cetera, just got me thinking even about, restaurants and others where there's other, queuing opportunities like that. And so be interesting to see how that unfolds. And maybe healthcare will be the industry that everybody starts referring back to and say, maybe we need to learn from those folks. So thank you again so much for your presentation this morning.